Public health ministers and high-level officials from 10 countries in ASEAN gathered on Thursday to discuss ways of tackling chronic non-communicable disease, state health care funds, tobacco and alcohol control consumption, and the spread of HIV/AIDS in urban areas. About 200 participants from Brunei, Indonesia, Malaysia, the Philippines, Singapore, Thailand, Vietnam, Laos, Myanmar, and Cambodia attended the 11th ASEAN Health Minister meeting, which was held in Phuket Province on July 5th and 6th. The event also included 3 key forums, one for ASEAN health ministers, another for ASEAN Plus 3 ministers, including those from China, Japan, and South Korea, and the meeting between health ministers from ASEAN countries and China. The theme of this year's event is ASEAN Community 2015 Opportunities and Challenges to Health.
And there will be a lot of health challenges coming with the new lifestyle of the people in ASEAN. Bigger middle class, higher purchasing power, moving around the landscape, but also will be bringing a lot of health risks to the rest of the population. So the ASEAN ministers are very conscious of their own responsibility to make sure that ASEAN is not going to be only prosperous, but also will be healthy.
Public Health Minister Witaya Buranasiri said the meeting focused on 5 main health issues in the ASEAN community, among them access to medical services for patients with non-communicable diseases such as diabetes and high blood pressure, in the bid to reduce the severity of disease and complications. The meeting also highlighted tobacco and alcohol consumption control through the implementation of tax measures, free trade agreement, and regulations that ban tobacco and alcohol companies from organizing social and corporate responsibility events. The measure to control illegal tobacco was also on the table. Delegations also discussed ways to implement universal health coverage and HIV/AIDS prevention in the region, as well as cooperation for establishing field epidemiology training networks. According to the Public Health Ministry's record, more than 2.5 million people in ASEAN die from non-communicable diseases each year. Smoking, drinking alcohol, lack of physical activity, and inappropriate nutrition are the main causes of death from non-communicable diseases. ASEAN's top 4 chronic diseases are coronary artery disease, chronic obstructive pulmonary disease, diabetes, and cancer. To tackle these health challenges in the region, ASEAN countries are committed to intensify cooperation in health development and to mobilize resources at the national, regional, and international levels to tackle health priorities, especially the increasing disease burden from non-communicable disease and the increasing prevalence of tobacco consumption. They have also set a goal to achieve universal health coverage, make efforts in achieving zero new infection of HIV/AIDS in the region, and establishing an effective response system to all kinds of public health emergencies at national and regional levels, as well as to emerging infectious disease, artemisinin-resistant malaria and dengue. The next meeting will be held in Vietnam in 2014. Bongpon San Samak, The Nation's Report.